Yes.
Hello, good morning. I am Dr.
Yes.
Vishwas. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, doctor. I am Charlie Zeteron, 40 years old.
Yeah, nice to meet you. How can I address you?
Oh, well, you can call me Theron.
Okay, Mrs. Theron, I have got a letter from your GP saying that you have some rash over your skin for last few years. Is it right?
Yes, doctor. Yes. Actually, I've been suffering from this problem for quite a long time. I'm here so that I can get help from you.
Okay, I am going to discuss about your condition and I will take some notes during our conversation, but all the information during our conversation will be remain confidential. Is that okay for you?
Yes, doctor. It's quite all right.
Okay, so can you please tell me in your own words what is happening with you?
Well, doctor, it's actually it's not a new thing. I have some health issues from my childhood. Actually, uh, I have I've been a diagnosed patient of asthma. It was diagnosed at around 10, I think 12 years when I was 12 years old. Uh, so usually the asthma is under control, but 3 days back I had some quite deterioration of my asthma control, and also I have some skin condition. Okay, I have some rashes in my skin, which are also present for quite a long time now. I think it's been present for many years now. But recently, for the last 1 or 2 months, I think it's getting much worse. Okay. Previously, it was just itchy, but recently, I think that my skin is also breaking down a bit. So that's a bit worrisome for me, doctor.
I'm sorry to hear that. Can you please show me the exact site where do you have this rash?
Yes, doctor. Actually, I has in my flexure, actually in my elbows. Okay, I think, and also in my some armpits. Okay, doctor. And recently, I also have this rash in my hands. I think
Okay, and anywhere else have you noticed any rash or any skin signs?
no, no. I think these are the main places where I have having this.
Can you remember where it started first?
I think it started in my arms first.
Okay, and is it spreading slowly or gradually?
I think, doctor, slowly and gradually. I cannot differentiate. What is this? I think both are same.
Okay, and I am sorry that is it spreading rapidly or slowly?
I think it's not spreading, doctor. Actually, it's not spreading. First of all, it was near my flexures in the hand. Okay, but later on, it didn't spread to that. But later on, I found that some separate rashes in my armpits, and for the last 1 2 months, I think I have been seeing this rash in my hands as well. And it's not spreading, but there are separate rashes. But the type is almost same. It's dry, some dry skin, itchy skin. Previously, it didn't break down, but nowadays I feel that it's more breaking down more, especially in the hands. The skin is also breaking down, I think.
On your back side of hand or on your uh, front side of your hand?
I think on the front, doctor.
Okay, and all over your hand?
No, doctor. I think more in the creases, that areas, like in the fold, my elbow fold, the fold of my forearm. I think. Okay, these folds, I think, get more involved.
Okay, and you said that these are easy.
Itchy, yes, doctor. Itchy.
Okay. Have you noticed any fluid filled some lumps ever?
Sorry.
Have you seen any fluid filled lumps?
No, doctor. I haven't noticed any fluid filled lumps.
Okay, when you scratch them over, does it bleeds?
No, doctor. I haven't noticed any bleeding, doctor. But it's
Any
itchy.
any fluid come out?
Uh, no, doctor.
Have you noticed any crusting?
So, doctor, I think that there is some scratching and some scaling, I think.
Okay. And on your elbows, all over the same type.
Yes, yes.
And elbow, that means on back of your hand, elbow
No,
side.
no, I think it's front, last over the fold. Okay, when we fold by hand, those areas are affected more.
Okay. And can you remember that does it comes and goes or remain the same over the years?
I think it had been almost same over many years, doctor. I think these were around quite early in my life that this came, and gradually it involved other sides. I told you, but
Can, can you tell me the color of the rash area? Is it purple color or whitish color or hard and thick skin?
well, doctor, I think that it's now sometimes it's I think dry, and sometimes I think some redness is also present there, and some scaling is present.
Any furrow or any creases have you noticed?
No, doctor, I haven't noticed any furrow or creases.
Okay. When does it feel itching more? At daytime or night time?
Doctor, I haven't noticed any like this, anything like this.
Can you tell me that anything makes it worse? Have you found anything?
Doctor, one thing that I should tell you that whenever I notice that whenever I use any water or soap, I think that rash, specifically in my hands, this gets worse and the skin peels off. I think.
Okay. And anything makes it better? Have you noticed anything?
I couldn't notice, doctor, but I think that when my asthma control is better, I think that sometimes I have that less frequency. This itching is, I think, a bit less at the times.
Okay. And can you tell me that how much severe is this condition?
Doctor, it's actually quite severe. So actually, quite severe means recently. It looks ugly, and I am a bit now. I'm a bit depressed, doctor, because it looks very bad in my hand. Okay.
Okay. And can you tell me that do you have any allergy to any products, any certain chemicals or any certain clothes?
Uh, Doctor, not like that, but I think that I have some pollen allergy from my childhood. Okay, and I usually try to avoid that dust and pollen.
Okay. And do you need to use or do any more water work, any water or use any excessive detergent?
Doctor, actually, I am a hairdresser, so that is what I use, nothing else.
Okay. And I'm going to ask you a few other questions. That do you have any headache?
No, doctor.
Any rash in your hair areas or any in your head?
I haven't noticed, doctor.
Okay. And any changes in your vision?
I haven't noticed.
Have you noticed ever any color change of your eyes?
No,
Any rash anywhere in your body except those you've said?
no, doctor.
Okay. And any ulcer in your mouth?
No,
How about your appetite?
quite well, doctor.
Have you noticed any changes in your weight?
No, doctor.
Do you have any hot or cold preferences?
No,
Any shortness of breath?
no, doctor.
Any chest pain?
No,
Any racing or pacing of your heart?
no,
Any lumps or bumps?
no,
Any changes in your bowel habit?
no, doctor.
Any changes in your water work?
No,
Any weakness at any side of your body?
no, doctor.
Any joint pain?
No,
Any changes in your nails?
no,
And you said that you have asthma since you were 12. And is it under control?
Doctor, it was quite under control for the, but I think that recently, for the last 5 or 6 months, the control is getting a bit worse. Doctor, I usually used to take inhalers, okay, the blue inhaler, and recently for the last 2 or 3 months, the doctor told me also to use the brown inhaler as well. He told me that gradually it's getting a bit worse.
And how often do you need to use a steroid? You said you need to use steroid tablet.
That steroid inhaler, at the beginning, 6 months back, I had to use it very rarely, but now I think that I have to use it twice a week, sometimes thrice a week.
And using it sometimes makes your rashes better.
Yes, sometimes I think so.
Okay. And do you have any other problem? Are you aware of it?
I don't notice. I don't know, doctor. I have noticed like that.
Okay, that's not a problem. And you are taking those inhalers. Except those, are you taking any other medication?
No, doctor.
Any over-the-counter drugs?
No, doctor. But since I have that skin condition, I sometimes take some over-the-counter skin softening, moistening agents. I think
And did those help?
not that much, doctor.
Okay. And any other Halvar products?
No,
Okay. Do you have any allergy to any medication?
no.
Okay. Any of your family member have this type of condition?
Doctor, I think my father also had this type of condition.
Okay. And was he diagnosed with any condition for that? Do you know? Do you receive any?
Well, doctor, no, doctor, actually, he did. I don't know about it.
Okay, that is not a problem. Any disease that runs in your family?
Uh, some I have. I think some members of my family have asthma.
Okay. And I am going to ask you a few personal questions. Is it okay with you?
Yes,
Do you smoke?
doctor. Within personal, within not so smoking, doctor. I just drink alcohol.
Okay. And do you know the social limit?
Yes, doctor. I usually drink very less.
Oh, that is not a problem. And whom do you live with?
I live with my husband.
And do you think that you need any social support from us or any other support?
No, doctor. I think it's I'm quite okay in socially.
Okay. And as your job, I think you're related to your condition. So I will talk to the health care department, and they can find a suitable job or any relocation at your job place. Will it be okay for you?
Okay, doctor.
Okay. And do you? I am going to ask you a few personal questions. That do you take any contraceptive pill?
Yes, doctor.
And do you have any history of child loss? I am sorry to ask.
No, doctor.
Okay. And is your period regular?
Yes, doctor. It's quite regular.
Okay. And do you have any other concern? Time up?
No, doctor. Actually, what's causing me? What's the problem that's causing this problem?
Okay, as I have taken your history, I need to examine you, then I could give you the best explanation. As far as I've taken your history, it seems like that this condition is related to your asthma, that we call it atopic dermatitis. Do you have any idea of that?
Uh, no, doctor. I don't know in details.
Okay, actually, some you as you have asthma, so they can also affect your skin, so that skin cells get dry and they die out, so that you are having those problem. And for this, we
Mhm.
are going to take uh, advice from the we are take advice opinion from the skin doctor. and they will be able to give you the best explanation. They will be able to treat you in a better way. And also for your asthma control, we will take opinion from the asthma doctor.
Okay, doctor. Okay. What do you think, that will it be all right?
I think the skin doctor and the asthma doctor, they will be able to give you a best solution.
Okay, doctor. That's all right.
Do you have any other question?
No, doctor.
Okay, thank you.
So, what is the diagnosis here?
Okay, for this lady, I have a few differentials that it can be a case of atopic dermatitis, then can be a case of scabies. Then I will also consider lichen planus and psoriasis.
Okay. You told that this is dermatitis. Is it right?
Yes.
Well, can you please tell me that some different classification of dermatitis?
Okay, some uh, I forgot actually.
Okay, I think atopic is quite right, but I think I told that there has been some recent development with soap and water in the hands. So,
Yes,
is it the same
I think
atopic?
it is irritant dermatitis.
It can be both, okay, because one is done for a long time, and I think it would have been better if you have mentioned that he might be suffering from both atopic dermatitis and also some irritant
Yes,
contact dermatitis. I think this would have been a better answer.
yes.
Okay, and okay, and how do you, what examinations would you like to do in this patient?
For this lady, I will first go for the pulse, then blood pressure, and after that, I will go for the examination of her rash, examination of the rash area, that where does it present. I will examine all the rash area, examination of rash area for its site, then it skin condition, then any bleeding, then any escally, then any signs of secondary infection, then any cracks or any vesicles, any pustule is present or not.
Mm,
Then I will also go for the skin sense that is hypertrophic due to chronic scratching. Then
mm,
after that, I will examine her finger waves, then examine
mm,
her nails, and after
mm,
that, on the elbow, I will also examine for those rash.
mm,
And
mm,
then I will go for to examine her hairlines, then eyes for any
mm,
changes in the iris, then
mm, mm,
anemia. After that, I will ask her face for any malar rash and mouth, any
mm,
oral soreness or rash is present. And after that, I will listen her lung. That's any signs
mm.
of asthma, for any signs of asthma.
Yeah, yeah, yeah.
And I will after
Okay.
that I will go for the skin for dipstick test. Oh, sorry, my urine for dipstick test.
Mm-hmm. Okay. Okay. So, what can be the treatment for this patient?
Okay, as it is a case of dermatitis, so for this avoidance of the irritants she's suffering from, like any dye or any products, like any latex products or anything, any other
Mm-hmm.
certain chemicals. Then keeping her hands moist by moisturizer, like petroleum jelly, and then uses of some tar, and then urea based products. And after that, I can also prescribe her some local steroid cream. And also I will take opinion, especially from the dermatologist, for her better management. And in this regard, I will also take opinion from the for her asthma, for maintenance for best management of her asthma.
Okay, that's, I think the, yeah, okay, that's very good, and thank you, doctor. I think think has been a very good tracking. We have discussed about the rashes. I think there can be. Hello.
Yes.
Hello.
Yes, I can hear.
Okay. Okay. May I actually the one thing that you have done, just you could have told that actually I think this is a case of dermatitis. Okay, this would have been a much better answer because I think they both are involved, atopic dermatitis and uterine contact dermatitis. I think both have been involved in this patient. There are again some issues that could have been asked, like any recent onset of fever. Okay, could have been important, and I think when there is this type of dermatitis, atopic dermatitis, sometimes the causes may be some sinister causes. Okay, like some agamoglobulinemia or celiac disease or mycosis fungoides. Okay, sometimes atopic dermatitis is associated with this type of conditions. So these things, I think it's important to actually rule out. And also, I think that you could have asked about some house dust mite. Okay, pollen. I told you about pollen, and I think some dust mite like old pillows that could have also been asked. Okay, and that's I think, and sometimes irritant contact dermatitis can also present with blistering. Although this patient, I didn't tell anything about blistering. That's all. I think, and again, another thing you should have asked that how what happens when you are exposed to sun. This should have been asked, I think. Okay, photosensitivity. Sometimes dermatitis can be photosensitive as well. Okay. These are the very small topics this could have been asked, and other topics I think you have covered quite well. Okay. Do you yourself want to add anything?
No, I cannot remember actually.
Yeah. So actually, when you ask about blisters, what things should you ask? Any crack, any fluid field? What should you ask?
Okay, any fluid filled lumps?
Okay. And does this lump break down easily or not? I think
Yes.
this is also important. Yeah. And any crusting. Sometimes after this breaking down, there is some crusting, I guess. Am I right?
I couldn't hear you actually.
Some crusting issues.
Crusting, yes.
Okay. And any other things regarding blisters?
Some pus filled blister, if it is pursued, then I could have think about the secondary
Yeah.
infection.
Yes. Okay. That's very important actually. Okay. Because some pus field or blood field, I think blood is important or not?
I have no idea.
Okay, I think pus field is very important. And recent history of fever, I think, is also important. Raised temperature or any trauma or any skin cut, recent skin cuts. I think these are also all very important. Okay.
Okay.
Okay. So I think that's all for the case. Okay. Thank you.